Hi, my name is Erica LeGrand, and today we'll be talking about C. trachomatis, which is another name for chlamydia. The objective of today is to learn all about chlamydia. Chlamydia's scientific classification, its domain is bacteria, along with its kingdom. Its phylum is Chlamydia iota. Its class is chlamydia. Its order is Chlamydialis. Its family is Chlamydiaceae, and its genus is Chlamydia. The species is also Chlamydia trachomatis. Chlamydia's life cycle and habitat. Chlamydia has a biphasic lifestyle cycle, switching between infectious elementary bodies, which is also known as EBS, and replicative reticulate bodies, which is known as RBS. They multiply within an exclusion and then revert back to EBS, which are released through lysis or extrusion. It primarily infects epithelial cells in the genital and ocular mucoses. Chlamydia's shape and arrangement. Chlamydia is a tiny round to oval bacterium that is difficult to detect using gram staining because of its intracellular lifestyle. Microscopically, it appears in small inclusions inside host cells. It's typically cluttered in specialized cell lines such as McCoy or HeLa cells pretreated with cyclohexamide. Chlamydia's gram status is classified as a gram-negative bacteria, but its gram status is not usually confirmed using conventional staining techniques due to its small size and intracellular location within the host cell. Chlamydia antibiotic resistance is typically responsive to antibiotics such as azithromycin and doxycycline. Through resistance to tetracyclines and macrolides has been observed due to emergence of resistance mechanisms. Is essential to monitor treatment effectiveness and select appropriate therapies accordingly. Diseases caused by chlamydia include trachoma, genital infections, and respiratory infections. Trachoma is an infection in the eye that can lead to the loss of sight in your eye. Genital infections like STIs or PDI. PDI is a pelvic inflammatory disease. And also LGV, which is lymphogranuloma venereum. And then respiratory infections, certain strands can cause pneumonia. Chlamydia's transmission is mainly spread through sexual activities, including vaginal, anal, and oral. It can also pass from infected mother to the child in her womb, potentially causing neonatal conjunctivitis or pneumonia. Signs and symptoms of chlamydia are genital infections, ocular infections, and respiratory disease. Symptoms may include urethral, in the genital infection, symptoms may include urethral, vaginal, or painful urination, and genital pain or swelling. Women are often asymptomatic, but untreated infections can lead to complications like PDI or infertility. Like we discussed earlier, the ocular infections can lead to trachoma, which is the loss of eyesight. The symptoms of it is causing itchiness, discharging your eye, and scarring of the eyelids. And respiratory infection presents as pneumonia in neonates. The standard treatment of chlamydia involves a one-time dose of azithromycin or a 7-day regimen of doxycycline. Neonatal infections are managed with erythromycin, but finding a solution early to the process is important to prevent critical issues. Prevention of chlamydia is to use condoms frequently to prevent the spreading of bacteria, getting routine testing, ensure that both sexual individuals are currently getting tested if you do have it, to receive treatment to avoid the spreading and reoccurrence, and to screen newborns early in the mother's womb to show that there is a known infection. And an interesting fact about chlamydia is that it is among the most prevalent bacteria STIs globally, with approximately 130 million new infections each year. In regions where trachoma is widespread, it is also the primary cause of preventable blindness.